It's really important to put patients first because actually they know better about their condition. They've been living with it, they often understand it, and so by hearing from them it really helps us think better. I think the other thing from the AMRC perspective is that I really want it to become something that is the norm rather than something that people pay lip service to. So often people say, oh yes, we want to put patients first. But actually they're not, and actually we heard earlier today, if they are, they're bringing them into the room, it's tokenistic, and possibly the only thing they're doing is speaking perhaps at the end. We need to change that dynamic and make this really become much more of a reality so that we hear and learn from what they've got to say, and I believe that we'll get much, much better research as a consequence. Well, I'm delighted with this event. It was a risk, putting it on in a certain sense. We wanted to do something different, and I'm so delighted that our sponsors, our partners have really come together to make this today's event. It's really buzzy, people are making new connections, and I think this is a great inaugural event from which we can really build going forward. And I hope people will go away having made some new connections which will help them in the next year make patient-centred research a reality. I mean, one of the things I would like us to do after today's event is to have a chat with the ABPI and look at whether there is this sort of over-compliance through the sort of governance departments at big pharma organisations, so that we can actually get patients and industry into the room to have a conversation about this area of research, medical research in the pre-competitive stage. So I will be following up personally to sort of say, let's see whether we can do something, perhaps it's a bit of guidance or some discussions, so that next year we can have even more people here.